Hey, welcome to another video from Skinny Medic. I have a pretty cool video for you, I think, this week. This is going to be how to build your own trauma kit. Now, there's plenty of companies out there who do pre-made kits, things like that, where you can just go, click add to cart, add your credit card, bloop, and it gets shipped to you. medicalgearoutfitters.com. But also, some people want to build their kits. You have a little bit of knowledge, maybe you have a lot of knowledge, you know what you like, you have your preferences, and you're set in your ways. You're like, I want this tourniquet, I want this pressure bandage, I want this hemostatic gauze, I want these chest seals, I want this MPA. You know what you're doing, you know what you want, so you build it. Maybe you have just enough knowledge to be dangerous and you're looking for a little help. I think this video is for you. So in my videos, I always say you never know when you'll be the first responder. Remember, you need the right gear and the right training. Well, this week's episode is sponsored by Elite U. I think that follows exactly along our tagline. Elite U is a video platform that provides raw, nonsense, realistic, real-world skills that need you to prevail. They have detailed lessons on protecting yourself without weapons, edge weapons, with a pistol, with a carbine, while driving, clearing your house, the mindset to prevail, and much, much more. I will put a link down below to the Elite U. Thank you guys for the sponsorship. I appreciate your support. When you're building your trauma kit, you want to think about March, massive bleeding, airway, respiratory, circulation, and heat loss. Today we're going to build a small trauma kit. This is one that's going to go into a pouch that's on you, on your vest, on your belt, on your ankle, things like that. It's a very small kit. We could absolutely expand to it at any time, add more items, plenty of stuff we could add to this kit, but this is just a good foundation. The first thing I would think about when building a trauma kit is a tourniquet. Probably two, but foundation level, just one. TCCC has a committee that recommends equipment for us. So they recommend tourniquets there. They've been tested and they're proven. So I would stick to those tourniquets. I've done videos on that. Prep Medic's done videos on that. You can just search those videos and they're out there. For me, I like the Cat and Soft T. Those are my kind of go-to tourniquets. So pick one of these and stick with it. Once you find one you like, I would stick with it and keep going boom, boom, boom. That way it's not a different training mentality. You know how to use it and you know how it works. So pick a tourniquet that you trust and you know how to use, you feel comfortable using it. A tourniquet is going to be for massive bleeding on the arms and the legs. We want to try to hold direct pressure first. If that doesn't get the bleeding stopped, apply the tourniquet. Arms and legs, high and tight. That's just the easiest thing to teach you guys. Don't freak out. That's a huge discussion about 3 inches above or high and tight. Just go high and tight. That's the easiest thing to fix it for you guys. And then put it on there. Okay, there again. Tourniquet's gonna be on for 2 hours. No problem. They'll go to surgery. It'll be okay. But massive bleeding, arms and legs, get a tourniquet. Pick one you like, pick one you trust. While we're still in massive bleeding, let's talk about hemostatic agents. There's really two big ones on the market. You have combat gauze, which this is the trainer version, and then you have Celox Rapid. These both are hemostatic agents that work well. If your budget is able to afford these, I would go with these. If not, you could just use regular compressed gauze, roll clean, things like that. But these are going for groin areas or shoulder areas. So shoulder, groin, places where you cannot get a tourniquet. You can even use in the neck area if you've got massive bleeding, like the carotid artery's been cut, you can go here. You can wound pack with it, or if you don't feel comfortable wound packing, just hold direct pressure and the clotting cascade will work its way down. It's not as effective, but it will absolutely work. To finish up our massive bleeding section, we have tourniquets, we have gauze, so we're able to control bleeding in the arms and legs and in the junctional areas. Let's talk about pressure bandages. There again, there are plenty on the market. NAR makes them, TagMed makes them, Agent H makes them. There's these Rayleigh pressure bandages. Plenty of people make pressure bandages. Pick one you like and go with it. So like this one here is the Elias bandage. However you say it, Elias is what I call it. I like this one. It's bulky, but I like this one. It has a lot of things that come with it, so that's an option. Yeah, there's Rayleigh. This is a 4-inch version here. So you can open it up. I generally do take it out of that first package there, and this is how it sits in my trauma kit. Open up the red tab, and now you have an elastic band. Here we have a pad, absorbent pad if we need it. It's kind of sticks together so it doesn't completely unroll on you, which is nice. But this is going to be used to hold our gauze in place that we were holding pressure with. Maybe it's up here in the shoulder, neck area, the groin, wherever we're holding pressure. So we can use this. We could use this just for a nasty cut. Like, there's tons of options for a pressure bandage here, but it's definitely a needed item in your trauma kit. M, massive bleeding. We got that taken care of. Next is airway. If you don't feel comfortable doing an MPA, then we can log roll them into a recovery position, roll them on their side, kind of give them a little kickstand here. That way the blood, vomit all comes out this way, whatever you need to. Don't leave them on their back. Usually when they're snoring, that's not a good idea. But if you feel comfortable, you can use an MPA. This one is a 34. She's a big girl, but typically a 28 is what we see. There are ways to measure this here. You can see this one is actually way too long for me. It should come to about right here, but 28 generally fits. Now, they make different sizes, so you could properly size this and actually place the correct size in your patient, which would be fantastic. But if you don't feel comfortable doing this, you don't have the skills and knowledge, then I would recommend during A is to log roll them, okay? Put them in the recovery position. If we were going to build an expanded kit, I would add a suction in there just so you clear blood and vomit stuff out of their mouth, but we're not building that kit today. Maybe in another video. Massive bleeding, airway, respiratory. This is where we seal the box. When we're wound packing the muscle cavity. There is no muscle cavity. This is all open. So you do not have enough gauze to wound pack bleeding inside here. You put a chest seal on it and you let God take care of it. Chest seals. There again, there's plenty on the market. Pick and choose what you want. The halo here, hyphen here. They're vented chest seals. As long as the hole in the chest is larger than 3/4 size of the trachea, okay, getting a little technical there, you put a chest seal on it. Easy enough. So anywhere in the chest, back area, even the neck area, we can seal that up. So throw a chest seal on it and get them to surgery as quickly as possible. With the proper training, knowledge, there's some liability here. You see some guys add some fluid decompression needles here. There again, you need the training and gets into the legal aspect of that. If I was going to build an expanded kit, I would throw a BVM in there because if the patient's not breathing well, they're breathing like 6 times a minute, they're purple, they need some oxygen, they need ventilation, so I would add a BVM. This is a normal size BVM like you see on every ambulance in America. They make a pocket BVM, which is super small, but we're not building an expanded kit. Forget that. Under C, circulation. For you guys, this is go back and double check and make sure you did not miss anything. Okay, you've got the massive bleeding taken care of. You've got the airway taken care of. You've got the respiratory taken care of. Just go back and make sure you did not miss anything. It's easy to do. Easy to miss that gunshot wound, that large laceration here, things like that. Just go back and double check your patient. H, heat loss and head injuries is tagged into here. A survival blanket. Not much. It won't rewarm your patient, but it will stop them from going hypothermic, which is super important. And really, for head injuries, we can't do a whole lot. But once you've done all this stuff, you gotta keep your patient warm. And I know there's some of you who've already typed in the comments, you're like, oh dang, edit, backspace, backspace, backspace. Yes, paratrauma shears. You could go expensive X shears, Raptors if you want to, or you could throw the cheap $5 trauma shears in your kit. You're gonna need to expose the patient. You're gonna need to see the injuries that's going on. So, trauma shears. The other thing I know you guys are fussing about is gloves, okay? Yes, try to put gloves on. Really not a huge deal, but you don't wanna cooties. People are nasty. Wear gloves. So with everything going on in the world today, I hope this video helps. If you're looking at building your own trauma kit, kudos, great job for you guys. Thank you guys for watching. You never know when you'll be the first responder. Remember, you need the right gear and the right training.